So sometimes we see that family members forget to consider what the patient would want in terms of these are things that are happening to the patient's body and the patient's quality of life. And family members consciously or subconsciously are trying to hold on to things that they want as a family member, as they would normally want, right? You don't want to lose your loved one. You don't want someone that you care about to die or not get every single possible treatment. But that's not always necessarily what the patients want. And reminding families about that sometimes can be challenging, because you don't want to say to a family member, you're doing this and your loved one wouldn't like this. You can't say it like that. So it's sort of gently reminding people that we need to think about the other perspective, the patient laying in the bed who may not be able to represent their own wishes. And I usually like to do that by pulling back and just saying, tell me a little bit about your dad or your mom, and what kinds of things did they like to do, and what sorts of things did they find meaningful, and what matters most to them. And then talking about what the patient enjoyed, and then putting that in context of what it will look like, or what it probably will look like for 6 months from now if we continue on this path of most aggressive measures, that those things that that patient enjoyed and valued most in life are going to be gone. And then we can start having the conversation of, do you think mom would find life worth living in that situation? And sometimes when you reframe it like that and put it in context, people think about it and go, you know, you're right. Like, she's not gonna go back to the beach and look at the ocean. It's not gonna happen. I think that counseling involves more of exploration of what the person is experiencing. So why do you want to continue on a path towards the most aggressive treatment? What is the reason driving that decision? And then sort of picking that apart and understanding where the person is coming from. That can sometimes build bridges between conflicting families, so that if you can understand where one person is coming from and then understand where the other person is coming from, oftentimes they can meet in the middle and usually make decisions that are best for the loved one. And so, like, for example, some people are afraid that they're not going to be able to handle the death of a loved one. And so if that's the reason that they're pushing for full aggressive measures, despite the fact that everyone else on the care team and in the family feels that it's not the right decision, getting the support services for someone to deal with anticipated grief can really help to make them feel like it's okay to make that decision, and that they are going to be okay, and here are the resources and the support that you would need to have that. Other patients or other family members, they may feel a sense of guilt that they weren't there for a period of time, and helping support them through that and say, listen, you know, you've done everything that you can right now in this situation. Making the decision to continue full aggressive therapy, even though it's not necessarily in the patient's best interest, it's okay to make the decision to stop, and you shouldn't feel guilty about that, and you should make sure that you lean on your loved ones, and we can provide support services. So there's not a one-size-fits-all to counseling patients and their families in this scenario. It's really about understanding what's behind the conflict and then helping to mediate a solution and provide resources to support the problem.